Well, hey, Mariah.
Hi, Monique.
How are you today?
I'm good. I feel like we're extra giggly today.
I know. It's a good day.
We have some really fun guests.
Yes, the best
I
guests.
cannot wait to see what we're going to get into on this episode of the Heart and Soul podcast. It's going to be so good.
I know. And today's guests are all about health and wellness. And today we're going to talk about female libido. That's probably why we're giggly.
And a little male libido too.
All the libido. So stay tuned, and maybe we should get into it.
Let's get into it. We're welcoming today Kat and Chris Delp to the podcast.
Hello.
And we are going to talk about all kinds of fun things having to do with women's health and hormones and who knows what else. Let's go. Welcome to Heart and Soul, the podcast where we empower and inspire women to lead their best lives, harnessing the power of their hearts and souls. We are Mariah
And Monique.
your hosts and guides on this journey of self-discovery and personal growth.
In each episode, we will dive deep into topics that matter most to you, from self-love and confidence to career development, relationships, and everything in between. We believe that every woman has a unique strength and inner wisdom waiting to be unleashed.
Join us as we cover insightful heart and soul-centered topics and interview incredible women who've overcome challenges, chased their dreams, and found their true purpose. Through all of this, you will discover practical tips, strategies, and real-life stories to help you navigate life's twists and turns.
For whatever season of life you're in, this podcast is your safe space to explore, learn, grow, and possibly even laugh and cry with us. So grab your headphones, maybe your favorite drink, and we'll embark on this transformative journey together.
With heart, I'm Mariah.
And with soul, I'm Monique.
There'll be no limits. And thanks for inviting us. We're kind of excited for all of this. This is going to be great.
Yeah, we're excited to have you, actually. One thing we like to do when we start our podcasts is we like to just say how we met you guys. And I can tell you, we were talking about this. I met you when I had moved into a new house that we had built. And I think one of your kids maybe came across the street because you were the next door neighbor, and you come across and you're like got this cute little outfit and Southern accent and big hair. Don't care. I'm from Texas. And I was just like, oh boy. And our kids are similar ages, so they played video games.
Yep.
I feel like you parented my children and I parented yours, and hallelujah, it takes a village.
It does.
Yeah.
Yeah. I was so grateful to have you across the street for sure. Yeah. And 3 boys each.
Yes,
And so,
yes.
yeah, like little stair steps. And so it was great to have a neighbor with the same things going on.
Yes, I would agree. And then Chris, I met years later. I think it was like a local bar. Of course.
Yeah.
Where do we meet all the nice men? No, you introduced me, and you guys were in costume. I don't know if you remember this. You were like a paint swatch.
Oh, we were in 50 Shades of Grey.
Yes.
Is that what it was?
It was
Yeah.
a jacket with...
It was so brilliant.
Yeah.
I took every single gray paint swatch and all of Duluth, all the different colors, and then put it into a sports coat.
Yeah,
for the
I
50.
I remember. Oh, this guy's gonna stand out in my mind.
Yeah, he made an entire coat out of the gray paint samples, and I wore a gray dress, and he made a purse for me out of gray paint samples to a matching purse. So we were 50 Shades of Grey the year that came out.
And
Yeah,
she had carried a whip and some handcuffs for earrings.
Yeah.
It was it was a perfect costume.
Yeah, you guys are good at that. And Mariah and I, we like a good costume party, as you know. So, that was how we met.
And I met you through Monique. And I mean, from the first minute was like, well, these guys are fun and interesting and fellow entrepreneurs and passionate business owners. And it's just been really cool to watch the growth of your companies and just to get to know you. And from early on, we wanted to have you as guest of the podcast because of all the work you do for women, women's health, and just like all of the information that you can share with our listeners. I mean, these two are a wealth of information.
Absolutely.
Oh my
Yes.
goodness. And I've just really just so grateful for what you do for our community.
Thank you.
And I would love for you to just introduce yourselves and share about your businesses. And let's start with that.
All right. So my name is Kat, and I work as a nurse, local hospital here in Duluth for about 20 years, till right around the COVID time frame, and decided to step out and do something different and start a business. So I decided to do a med spa, and initially was pretty much given a little, told that I couldn't do it.
By your employer?
But yeah, I was just kind of like, you can't do that. So I did. That's pretty much what happened. So I left and I did, and I'm so grateful that I did. It really was life-changing for me to work for myself and to have that autonomy to be able to, help others and not go in and punch a clock every day. So for me, that was huge. And I also I was also in the beginnings of starting to go through menopause. And so I was, searching out those kinds of things. And luckily, I have an amazing husband who is well-versed in different therapies and anti-aging type of things that it just made a perfect fit for us.
Yeah, I was going to ask you why med spa, right? Out of all of the things you could have done. Yeah, and that's why, because of your own circumstances?
Yeah, a lot of it was my own circumstances. I had I loved beauty and doing all the things and the Botox and, I'm all for women doing whatever makes them feel good and not judging somebody for what they do. So I just felt like I was a good person to be able to offer those things because you can offer those and help people feel better about themselves. So it was just kind of an area that I thought, if it's a med spa, then we can also incorporate different other treatments, holistic treatments that other people have a need to have.
I agree. Yeah, that's awesome.
And you two are in business together because Dr. Delp, you're a big part of this with Kat.
I am indeed. She is continues to be my boss.
I love this.
I am a man who's very comfortable around strong women, which is why I'm enjoying being here.
That's why you get to be a guest on the Heart and Soul podcast.
Yeah, you're only our second man being interviewed.
Yeah.
I feel
And you just give off that energy of like so approachable. You have the warmest smile.
Well,
it's just
thank
like
you.
so easy to talk to. You have that disarming like comfort, and I can see where that fits in well. And you make some really great TikToks with the crew at the Duluth Med Spa.
She inspires me. Yeah. And I've been a physician in the community now for about roughly 30 years.
Oh, wow.
So long time. Mostly in the emergency department, but also as the associate medical director for the Lifelink helicopter system.
Okay.
For, almost 20 years now.
Wow.
And, so a lot of different things. But then she started to go through menopause and then was really interested in getting hormone replacement therapy. And there's a lot of misinformation about hormone replation therapy. And that's where it was easy for me to step in to a role to help her in terms of being kind of that woman's advocate, because there's a lot of issues that in women's health that have lagged behind men's health, and this is one of the biggest ones, and to have her really push this out there. I'm a great spokesperson, but not nearly as good as her. So it's I've got the technical expertise, but she's really the voice for all of this, and then the whole sexual health part of this for both men and women, but our initial focus was all women, and just having somebody. She'll talk about anything.
Yes,
there is absolutely no
that.
limits on what to and I'm very comfortable as well. So there's no subject that's taboo or that we're uncomfortable talking about. So it's nice to be able to play off of each other that way.
We put it out there for sure. I feel like as a woman too, he's saying, when I was starting to go through menopause, I really felt like any physicians that I would talk to, there was just not any help out there. I was just specifically kind of told, you'll get through it. You know, you'll get through it. The hot
Suck it
flashes,
up.
you know, it's just part of life. You'll get through it. You'll get through it. And for me, that answer was just not good enough. And I initially started seeking out other places to get answers before I even told him that I felt like I was going crazy. You know, I'm like, something's not right here. You know, something's just not right. And, you know, finally, luckily I have a spouse that I could say, you know, I need better answers than this, you know, and trying to find physicians that will treat women in hormones is not the easiest thing. That is changing, luckily. There's a lot more education coming out about that, and it is changing. But it's, for a lot of people, it's hard. Physicians years ago were not taught about that. They weren't taught how to treat menopause.
And worse, we were taught to advocate against it, and that was because of a very flawed study that was done, kind of rushed to publication prematurely. Two of the people that were actually on the committee of the study resigned because of they felt that they were rushing conclusions that weren't really supported, and all the subsequent studies have been redone in many different ways, many different countries. And so now we're starting to see the revolution, but the revolution is really coming from the women, and that it was been such. It's been kind of disappointing that it took the women really pushing that before that change started to happen.
And I think there's a big role too in educating men. Not just physicians that need to learn about hormone replacement, but educating the general public of men, because, you know, I feel strongly that you think about people and they say, oh, they've got the empty nest syndrome, or he's going through his midlife crisis and she doesn't want to have sex, or, you know, there's all these different things come into play. And that's about the time that the kids are graduating from high school. It's about the time that the kids are leaving. And it just so happens that's the same time women are going through menopause.
Yes.
And so it's men need to know that it may not be that wife doesn't want to sleep with you. She may not have any estrogen.
Yeah.
She can't turn that on. She can't physically turn that on. And so I think there's a real role in to educate men that it's not about you. It's not you. This is not you. My lack of desire is not about you. It's not about our relationship, but I need help because I can tell something's going on in my body. And I think to educate men to know that their wife or their partner is going through something like that could really change a lot.
And
it could change a ton.
Yeah, the way you just said that too, I feel like educates women on themselves.
Yep.
So it's not only educating men, but it's educating women on what the fuck is going on with me and how do I express it in a way that doesn't sound like, you know, sometimes people just get moody and they get combative and they don't understand, like there's a whole thing going on.
Yep.
So that's beautifully said. It's actually physiological or it's biology. It's inside of you. It's going on inside of you. And it's not necessarily because you had a bad day or you're crabby or your kids are leaving home or you know, whatever, you switched careers. Who knows?
Yeah.
Well, that corollary there, I mean, it seems so obvious, right? But yet it wasn't being made and it was being just pushed under the rug. Like women were, you know, taught to just we don't talk about that, right? We don't talk about menopause. We don't talk about our needs like that.
Right.
Sweep them under the rug, you know, suck it up, go through life. And then what happens? The fall in the emptiness syndrome and, you know, marriages falling apart and all of that. And all of a sudden it like a light bulb goes off and you realize, wait a minute. Yeah, we are different people because we are physically going through something that is changing our entire body chemistry. I actually sat my husband down about a year ago and was like, listen up. This is I don't really know how it's going to play out. Everyone's different, but I'm going to tell you, ride's about to get a little wild. And I'm not sure what I'm going to do about it yet. But I want to be aware that these symptoms are real and rooted in a biological change I can't fight.
Yeah.
Like, it's just happening. Train is leaving the station. So I want you to know exactly like you said, it's not you, but I don't want you to suffer either. And so we together are going to have to figure this out because it's happening and we're not going to ignore it. And I think that was really valuable and helpful because suddenly he could support me better, right? And say, what do you need? What doctors do you want to see? How can, what do you need me to do? Right? Versus just pretend there's no problem. That's not going to solve it.
And I think one of the biggest things that I look at too is it's not just menopause, it's perimenopause.
Yes.
That's when that starts happening.
That can be a long time.
That can be a long time. It's in your 40s. Some people have early menopause in their late 30s, but it's that perimenopause stage where your hormones are fighting and fluctuating and you're losing sleep. And then you've got this anxiety. And so you go to the doctor because you've got anxiety and they're like, here, take this pill. And it's not because of that. It's not, your anxiety may not be coming from that. And your lack of sleep can simply help with little progesterone, but they just don't look at it that way. I think there's just a big lag in, unfortunately, how, like he said, they were not trained in that years ago. That is changing, luckily, but there's so many little things that you can tweak and know in order to fix that.
Well, and the push was, it's part of the natural process. But I can guarantee you that if part of the natural process, if men lost their testicles at 50, everybody would be replacing their hormones. I'm telling you.
Oh my gosh. I like you more than ever now that you just said that.
True. We would be just passing out the testosterone.
100%. We'd put it in the water, right?
Oh.
Yep.
And that's what is just a huge tragedy is how women's health has been just swept under the rug. And the studies have been, poorly handled and not enough of them. And we've had another guest on here sharing with us about the studies. And it's just like, oh my God, you don't realize how little compared to men, women's health is being studied and focused on. And a lot of that's happening outside of the US.
Yeah.
And now we're aware of and turning to, well, you know what? If you can't help me here, I'm going to have to figure out how to go somewhere else because I don't want to just sit back. And I don't think any women out there should be. Like, we need to be advocating and using our voices with you helping us to fight for this.
Yeah, and I do think too, I look at the people that we've been treating at Duluth Med Spa with our hormone replacement program. I can see people coming in and they'll come to him and they're just at a loss of what to do. Their relationship is in turmoil. They're not sleeping. They've got all these, crazy anxieties and once they get on, hormones are getting back to where they should be. They're coming in 3-6 months later. They're like, oh my God, thank you so much.
Wow.
And it's just a game changer. And it's funny because I've been getting my hormones replaced now for a good year and a half, maybe, bioidentical hormone replacement. And I know my body so well now that I can tell him, literally I can say, I need to go get my labs drawn because I think this is low. Like, I can literally tell in that 3-4 month time period that I'm like, nope, I'm low. I need a pellet. Like, I can tell, and I can get I can get my labs, and he's usually 100. Usually, it's spot on. Because I can tell. I know my body now, having had depleted hormones, and now getting them replenished. When I'm depleted, I physically know it.
And there's sometimes when I say, it's time for you to get your labs checked.
It goes both ways.
Yeah, the work-life balance. I wanted to ask you that. The work-life balance.
Yes.
Yeah.
And we talk about how the hormones make you feel better.
Oh my gosh.
But when there's other big health impacts, and one of the biggest ones that we're seeing is a reduction in dementia in women. The data on that is irrefutable now that we
Due
see
to having more estrogen.
Yes.
Okay.
So women that are on hormone replacement have a reduced incidence of dementia.
Wow.
And the other one that we commonly see in the ER, we see as women get older, they get urinary tract infections much more commonly, and they can die from sepsis from urinary tract infections. And estrogen reduces the incidence of urinary tract infections. So there's other things, other health benefits that
osteoporosis. One of the biggest things women die of is heart disease.
Yeah,
and the hormone replacement can help protect your body in so many ways. And it's just wild to me that it takes this long for women to fight to try to get themselves treated.
Yeah, we have so many medications that are just standard, like birth control, or it doesn't make any sense to me that we wouldn't have a protocol. Like, I don't want to have a baby. Okay, take this. I'm not feeling good at menopause. Okay, here's our standard protocol. We just don't have it.
And it kind of stops after you have the baby, right? Then it's like, okay, well, cool, you've done your job as a woman, so good luck with that.
Yeah.
Right, good luck with the rest of your life.
Yeah.
Seriously, you're absolutely right.
Exactly
okay,
right.
cool. Like, we're just vessels. Like,
Yeah.
Right.
wild.
Right.
Yeah.
It is wild.
And we are so much more complicated too, I think.
Well,
Yeah.
Much more complicated.
yeah.
So, and that when we talk about sexuality and all of these medications that men have, and there's one FDA-approved medication for women for sexual arousal, and it acts in a completely different way than men. Men, these are all things that act on the blood vessels.
Okay.
And the medication for women acts directly on the brain because
This makes total sense.
I know,
Yeah.
because
Yeah.
we have to have the whole thing in our heads. If you're not emotionally secure, it's not even going to happen.
And this medication is a game changer. We offer it at our clinic, and it's called Addyi, ADDYI, and it's a great works a tiny bit like a SSRI somewhat in your brain. It makes you feel, it gives you a little bit of the feel good. So if you're somebody that's just like sitting there and you're thinking, God, I wish he would just not freaking touch me. You're just like, just leave me alone. It just puts you in a better place of just wanting that touch and wanting to have that initial intimacy. So it turns your brain on to the intimacy. It doesn't turn the rest of your body on. But when your brain is turned on to that, then it's certainly much easier for your partner to also get the rest of you going.
that old saying is really true, that women need a reason for sex, men just need a place.
Yes. Well, there's a book called Come As You Are. This is by the same author of Burnout, and we'll link the book in the show notes. But I thought that was so fascinating, just the science behind how women's brains activate and deactivate where sex is concerned. And it's something like nobody's taught that.
No.
You're not taught that like it isn't supposed to just happen, right? Like there needs to be these steps and just getting that out there, right? And then providing the support when life is making that really hard no matter what.
Oh, yeah.
Yeah.
Yeah, it's interesting about the fact that this is the only drug for women that's FDA approved for that, but there's so many for men.
There's so many for men.
There's TV commercials every day.
So you've got these men that have all these drugs to help them perform and have sex, and then you've got women who are not studied and not treated, and they have no hormones to even pretend that they want that. Do you know what I mean? It's just it's just such an imbalance, I think.
And you met the person that owns the company that made this woman, and it's a woman who developed this
drug.
medication.
Okay.
Yeah,
That's awesome.
and you got a chance to meet with her, which that was
cool.
that was very cool.
Going back to the menopause and the hormone replacement, something that comes to my mind is just how I think back to maybe when I was probably in puberty, that the news or all of the talk around is like, oh no, hormone replacement. No, bad side effects, cancer, can't do it. Like it became taboo. And that was probably based off the study that you're referring to,
the Women's
my
Health
guess.
Initiative,
Yeah. So now you've got like that whole generation of like my mom and the women in that age were like probably going through that. Now they can't do it. I'm coming up as I'm growing older, just, probably heard the news one time and it's like, well, I guess file that away under, that's not what happens. But things change. Science evolves. We realize that isn't correct. How do you then find out, right, that like, no, actually there are, there's more information on this topic. And so it's only just now with your voices and, people talking out about options for menopause, we're realizing it's so much more complicated than what that one study said, right? In some women, it might have side effects, but in other women, it has amazing positives. Like it's so much more nuanced than that.
Oh, absolutely it is. And they're trying to push that information out to physicians now, but that it'll be years before that catches up.
Right.
PBS did a great series, a great documentary called the M Factor, for
yes,
menopause
I remember
factor.
this.
And
I
that was a
wasn't able to
great,
come to your-
that was a great,
Yeah.
great one that gives all sorts of information about that, including gum disease that happens after menopause. We have a dentist friend, and she said, all these women haven't had cavities for decades, and now they hit menopause, and now here they are in her clinic on a regular basis.
Interesting.
Yeah.
Estrogen related.
Yeah.
Oh my gosh.
Yeah. All
There's
sorts
just
of.
so much information out there.
And that's because the women's, your physiology, your brains are all very, very complex. With men, it is very, very different. I mean, our testosterone levels do decrease, but it's not any of this kind of zigzag or a crazy sudden turn off that women experience. So their bodies change, everything changes so abruptly that it seems incredible to me that was not better studied.
I imagine that you become really adept at like reading labs for females and knowing. So how did you kind of like, because I don't know if that's something that you learn in school. Did you have to kind of teach yourself like when you look at a panel and what panel to even actually get, right?
Right. No,
You look
you're
at a panel, what panel to get. Once you know that, then like what are you low on? Because it's not cookie cutter. Like what might work for Kat might not work for me, might not work for Mariah, right?
Mm-hmm.
So how did you kind of go through that process of learning that?
So there's the Menopause Society, which I'm a member of, that offers all sorts of information and education on that. And then there's also courses that we take on and then continuous medical education. But the Menopause Society it was developed specifically for this kind of education, and they put out information on a regular basis. And as a physician treating women with all sorts of menopause-related troubles, you can actually submit that to the Menopause Society and get expert opinions back on.
That's really awesome.
Yeah, it is a great resource to have.
Yeah.
It really is. My mother was on hormone replacement up until she died at age 96, but she maintained her mentation. She did her first triathlon for her 90th birthday here in Duluth. Yeah.
Wow.
The Buzz Ryan.
Yeah, the Buzz
for her
Ryan,
90th
yeah.
birthday.
Okay, that's amazing.
Yeah.
By the way.
Wow.
The best part of it is as she was coming out of the water, all the news cameras were focused on her as she's coming out of the water. And there's some guy who was actually behind her who's kind of got his hand in front of his face because he didn't want all of his buddies to know that he was being beat by a 90-year-old woman, which was great. But she's kind of one of those examples of trying to maintain that balance, and the women that don't want to do that, that's absolutely fine. We want to support that as well, but we want to just have informed choices.
I was going to ask you about that
love
because
that.
of my cancer diagnosis. I'm HER2 positive.
Mm-hmm.
So like it's been tricky, right? Like I was having hot flashes, so I got on patch, and then I found out I had cancer. So I'm like, stop the patch, stop the progesterone. Like you do need options because of different scenarios for different people, right? So
and even in women who have had hormone positive cancers, the vaginal estrogens, you can get a lot of the benefits, and there's so little absorption that most oncologists say that's absolutely fine, and that way you can still avoid the UTIs. You can avoid the vaginal atrophy, and the systemic absorption is so minimal. And then there's also still the testosterone therapy, and testosterone functions in women. It has so many functions in women as well. It functions in the brain, not just for arousal, but it functions in motivation, and then maintaining muscle mass. And of course, with that,
for me, it was
bone mass.
testosterone that's big for me, I think, and that's a little bit also with brain fog.
Mm-hmm.
really,
Interesting.
testosterone is.
Yeah.
And is that from the panel you can understand what someone's low in and their baselines and stuff? Okay, so tell us what your benefits from getting
For testosterone, for me, it helps with your muscle, helps with the brain fog for me, sex drive,
Okay.
just all of those things. And when
Overall feeling
I think
better.
a lot of women don't even realize that they have testosterone.
Right.
They don't
Right.
and they don't, and then they get depleted of it. But I think a lot of women don't even think of testosterone as being a hormone that that women make, and because there's so much said about estrogen in women and men with testosterone, but
Right.
And
women need it too.
And it's not FDA approved because it costs quite a bit of money to get FDA approval. And one company tried to do it, spent millions, and they just didn't have enough money to do it and weren't going to make enough money because it's you can't really patent testosterone, and so they abandoned that. So the women don't have access to it, and again, there's physicians that sometimes are reluctant to prescribe that without that FDA approval, even though it's becoming more and more common and very well understood.
Now, it
that
is approved in other countries. I can't think of which country it is, but I just heard something on the news the other day that it was they approved testosterone in a couple other countries for women. I mean, it's something we make. Why, we just are depleted of it.
Natural. Yeah.
Right. So
I'm curious listening to this and thinking like, okay, where do you even start, right?
Yeah.
Where does someone start? They're identifying that they're feeling off. They're that perimenopause age, the brain fog, those
sleeplessness, night sweats.
Yeah. Whatever host of symptoms. And they realize like, yeah, I'm not sure this is something I'm willing to settle for or they want to settle for. Come to you. How do you walk them through this? What does this look like? Let's say it's me. Like what do we do next?
So what we do is we start with start asking questions, and some of the questions may be surprising to you because the role of even though these are called sex hormones, the role goes well beyond that. When you talk about the sweats and there's vascular effects that happen, so there's a whole slew of questions that we start with because like you say, you implied that there's a lot of nuance to that because yes, we can draw lots of labs, but you're not a number. And so we start with questions.
Okay.
Who are you? How is this impacting you? Because it's going to impact you way different than you. And how you're feeling is going to be very, very different from somebody else. So we start just by talking. And once we know kind of the impacts that are making in your life, including, how old your mom was when she went through menopause, that's very relevant.
The generational piece of it.
Yeah,
too.
no, you're right.
Yeah.
The generational piece is very important, and then just a regular health history. Are you getting mammograms and Pap smears? Do you still have a uterus? Because that makes a big difference as well.
Totally.
And then we draw some lab levels.
Okay.
Once those lab levels come back, and I have a chance to review them, and you get a chance to review them with me, then we make a decision on how to proceed from there. If you're interested in hormone replacement, there's lots of different ways to do that. The way that I prefer is these very, very small subcutaneous pellets that are completely absorbed over a very controlled amount of time, and about every 4 months, 3 to 4 months. And so we monitor your hormone levels during that time to make sure that you're getting the appropriate dosing. And these are basically just injected under the skin with an oversized needle that goes under the skin. You can't really feel those.
Looks like the size of a piece of rice.
Yeah.
Interesting.
Yeah.
It's like
And they just kind of like emit or
right. They're in an organic matrix that slowly dissolves in a very controlled manner. So as it dissolves, those hormones are, and that's
so much better than taking a pill or a shot of it.
Yes. And when we take pills, and I'm glad you brought that up, when you take estrogen in an oral form, all of that immediately, if it's in the GI tract, it first goes to the liver.
Right, which has a hard time with it, right?
Yes, it does.
Yes.
Oh, fascinating.
And it starts making more clotting proteins, and that's why, if you remember ever being on birth control pills, they always warned you have an increased risk of blood clots.
Yeah.
And that's blood clots to the legs, blood clots to the lungs, or stroke risk. And so the oral form is not really a great great form, especially if you're already at an age where you're having vascular risk factors. But if you put that under the skin, it's more delivered like your ovaries do. So there's no increased risk of blood clots whatsoever. There's a zero increased risk.
Okay.
And then in terms of the other aspect of this is if you have a uterus, if you're getting estrogen constantly, it can stimulate the lining of the uterus. And if you do that without progesterone, then there's a slight increased risk of endometrial cancer. So we always prescribe progesterone at the same time that you're on estrogen. And that eliminates that risk. It actually drops it below baseline. So it absolutely eliminates any risk of increased cancer when you balance these hormones in the proper way. And so every time you come in, we kind of just chat again, see how you're doing, because the dosing is calculated based on levels, body weight, all these different factors. But then there's a little adjustment that we can make too, depending on how you're feeling. And so that's why we always chat every single time, get a chance to see how you're doing.
Yeah. And now comes to mind immediately, is this all the type of thing that would not necessarily be covered by insurance? This is something people have to pay out of pocket.
Great question. Yeah. The insurance companies
just crazy.
Yeah. The insurance company. Better. You're getting me. Yeah, they're certainly not here to make us feel better or live longer. They're there for their profits. And I will battle these insurance companies and badmouth them till we don't have enough time for
that. So if you've determined someone needs testosterone, is it delivered in the same way as estrogen?
Yep.
With this little rice pill under the skin?
Pellet.
Yeah. Oh, interesting.
And we have all the different sizes depending on what your needs are. Yeah, it goes into at the same time and kind of delivered in the exact same manner.
And we have men that get hormone replacement too. With
I love that.
So
Okay.
there's men that come in when their testosterone is getting low. They'll come in and want testosterone replacement as well. And so,
and as a little other plug, there's one other plug for men's sexual health.
I was going to say our men's sexual health.
Yes.
New medication that we are now offering.
Really?
And it will be, we haven't, actually, this is the first time we've really announced it.
Debut. We didn't know that was going to happen.
It's not even on our socials yet, but.
Well, by the time this comes out, I'm sure
it will be. Yeah.
Let me just interrupt you for just a quick second, because most, like we mentioned, most men's sexual health are certain inhibitors that just increase blood flow, and that's fine. They work well. They've created a multi-billion-dollar market, but there's a combination now that you can add to that, and I'll let you take it from there.
And so it is going to be a compounded form, and we've trademarked the name. It's called Mydixadril. True story.
No, are you serious?
Dead serious. And
that is amazing.
It's called Mydixadril, and it's coming out in a compound form. We're still waiting on our packaging and everything to come out, but it's a little troche that men can put under their tongue, and it will dissolve in about 15, 30 minutes. They'll start having a little of the effects of it, and I'll let you explain exactly what's in our Mydixadril.
Oh my God.
The name is
I can hear the jingle now.
This is going to go viral, I know it.
So maybe you can write a little jingle for us.
Yeah. That's going to be a good one.
It's a
I can see the commercials too.
Yeah, it's a combination pill.
Or troche. So the generic terms for Viagra and Cialis are sildenafil and tadalafil, and it does contain those, but it also contains another medication, apomorphine, that's not related to morphine at all, but it acts on the dopamine receptors in the brain and does something very similar to the medication medication for women in that it does hit the arousal center for men.
Okay.
So, if men have any problems just with needing that feeling of arousal and that dopamine rush that makes you feel that attraction and that arousal, it does act directly on the brain. And so when you combine those, then you not only have the physiologic effect, but you also have that mental effect.
Wow.
And it's
Pants
got
on fire.
both. Yeah, it's got
That's an alternative name for you.
right.
I like it.
So we are branding it as Mydixadril, where science meets passion.
Oh my God, I love it.
Construction workers
Yes.
come to mind.
Yeah.
As part, like, I just have so many marketing thoughts right now.
Yes, where
This is
science meets
amazing.
passion, and it's great because it is that combination of of the two, and with the brain, with the epimorphine as well, that helps. So it does help with an immediate arousal, but it also lasts a long time because
Oh,
Cialis
interesting.
lasts longer.
Okay.
So you can have that. It's not something that's they can take it and then it can.
Yeah, it's just once a day.
Once a day, yeah.
This is the most
But
that
it's
you can
not because I don't know a lot about these things, but like the one thing I do know is there's one that is immediate arousal.
So it's got a little bit of that in it,
Yeah.
and it's
Okay.
got a little bit of the long term.
But that doesn't mean that they're going to be dealing with immediate arousal all day, does it?
take. No.
I don't know. We do have.
For a friend who needs their pants on fire. Just
So
kidding.
we do have four. We will have four doses of it. There'll be a low dose, medium dose, high dose, and a max dose.
Oh wow!
Yeah.
Max
Oh.
dose.
Yeah, max dose Mydixadril.
On the weekends, baby.
So genius.
So-
I love it. I cannot wait for this to hit the market.
Yeah.
I mean, just because I want to see you guys out there
Well, you heard it
celebrating
first.
it.
You
I
guys
heard
heard
it
it
first.
first.
I feel
I
so
love
honored. That's
Thank you for
amazing.
sharing with us, and our ladies are going to be like, what are
My
the show
what's a
notes? Where do I find this? Where do I
For
find
the
this?
for the ladies, I really encourage if you're anywhere near perimenopause and you're getting those goofy feelings or the night sweats and
Yes.
your brain fog and anxiety at 3 a.m. So I call them the 3 a.m.s, where everything is bigger at 3 a.m. problems. Do seek help because there is help for you. There is help for you. Your primary care may not be aware of all of those things. And that's not anything wrong with them. That's just the way that they were taught due to the old studies. But, we do offer help for that. And Addie is another great one. If you have can't turn that brain on for sex, it's one pill once a day. And that one usually takes about 8 weeks to start kicking in. It does work a little bit like an SSRI.
Okay.
But that's a great option for women too. Yeah.
So it's
maybe
daily.
we can get another invitation back after we've given these thorough testing so that we can.
I'm like, can we be guinea pigs? Are we giving
Where do we
ourselves
sign
any
up?
tributes
That
to
would be
the cause?
We
Like,
can, we can maybe compare notes.
yeah. My gosh.
Or maybe we'd have to have our partners on to compare notes.
Oh my
At what
God.
point did she attack you?
Right.
I think this is so relevant. I feel like I'm the perfect age and like it's all so relevant to me right now. That's
To your
how
point,
this is
though,
feeling.
I have like 30-some-year-olds. I'm starting perimenopause, and I'm like, what in the world? No, but it is. It's happening younger and younger that women are just feeling out of balance. They feel off with their hormones. Gone are the days
People
when
are going through it sooner.
Yes, they really, really are. And it's just lasting so much longer. And it's so nice to know that there are options out there. That they don't have to struggle for years with hot flashes. They don't have to struggle for years with the mood swings and the menstrual irregularities.
The progesterone is a godsend for sleep. And I just wonder why every provider is not offering that for these women that are coming in menopausal age. They're like, I can't sleep. Well, you don't have your hormone, so it's just wild to me.
And like you said, you go to your provider, right? You go to your primary care physician or whoever you're seeing. I don't even see an actual like MD anymore. It's nurse practitioner, whatever. And it's like they fill out the form. They ask you the standard questions. They're like, you good? I mean,
Right.
it's such a formulaic.
And it's once a year and you can't remember everything that's the matter with you. Well, last week I had a creak in my knee. And
Literally, my mind goes
pain.
blank. I'm
Right.
like, I'm fine, right?
Mhm.
But even if I did, like, I don't know. I just you feel that there's really no, like, there's no there.
And that's why the hormone consultations are so great, because you are going through a lot of different questions and a lot of different scenarios and talking. You can talk with Dr. Delp and he'll go through, like you said, there's just a lot on an intake of hormone consultations because what might be missing from your life may not be
totally
affecting you.
Totally.
And so it is very specific.
And a lot of the providers that I know are focused. They've got very limited amount of times because the hospital's driving them to see.
15 minutes, you're out.
And so they're addressing things that are going to kill you. They're going to make sure that your blood pressure is controlled and that your stroke risk and all of these things are addressed. And then maybe this is going to be just another specialty thing where if you're having hormonal problems, see a hormonal specialist. Yep. Just like if you're having other issues, your primary would shuffle you to the appropriate specialist because they don't have the time or the resources to really dive into that when they are so overwhelmed and overworked. And I see that. I see that they are just doing their best just to keep their patients alive, and to have those time limitations imposed on them is really hard to see.
And this is like a quality of life factor, right?
Yes.
Like these are things that we're talking about that
extending your life
is extension and equality, but it isn't. We are in a medical system that is about emergent, right? Like things that are emergencies or life threatening. And so when you're in that thought, and that's what the insurance will cover, that's where the focus goes. But really, if we were able to be forward, abundant thinking and focus on the quality of life and that aspect, we'd probably, take care of a lot of our emergent things. But that seems to be the mindset. So if you're advocating for yourself and you're like, okay, well, I don't want to live this way. Well, now you've got to think like, well, how much do I need to save to be able to afford the life that I want to be living, because no one's going to get it for me. I'm going to have to go get this for myself, right? And thinking about like preparing women younger in life to start saving for their future hormones, right? Or their weight loss medications or whatever it is, because the reality is you have to take that initiative on your own. You need to be the one advocating for yourself, because your doctor's not necessarily going to do it. They don't have time. And I totally respect that. Like that's not their protocol.
And the finances, our hospitals are struggling to make ends meet, where the insurance companies are making billions, and that has been very destructive to our healthcare system.
Doesn't compute.
Yeah, it does not, and so when it's requiring that kind of advocacy and saving, that's really disheartening, isn't it?
Right. I'm like, my wheels are turning here as I think about. I'm gonna sit in a position of privilege, right? Like if I want to do this, I'll figure out how to afford it.
Right.
I'll give something else up. But that's
It's a privilege. Yeah.
That's a privilege. And the number of women that this is never, ever even going to be on the table for them breaks my heart.
Yeah.
When it is basic common sense.
Yeah.
And it really does extend your life. Your hormones are going to help prevent all of these issues that women will have later on down the road. The UTIs, the brain, the Alzheimer's, all of the arthritis, osteoarthritis, those, it's preventative. You have those hormones and then they're depleted, and damn it, we want them back.
No
it's
kidding.
Logical. It's just logical. If you really just stop.
Well, we were living longer,
this.
right? Like the turn of whatever, 1900s, we lived to 45. Now we're living to 100 or 90s at least. So it makes sense that we need better care for that, so that we can live quality of life at the latter part of our lives, and not just have it be like, I don't know, or bumbling around in like a nursing home. Nobody wants that.
Yeah.
Right?
Right.
It really struck me when you said the piece about dementia, because that's in my family, the women, that's the route, right? Like both my grandmothers, that's the route in their 80s. And I think about my own mother, and I'm like, well, wait a minute. Can we put the brakes on this now?
Yeah.
Like,
Right.
when's too late, right? When should you start? Because if there's something that we can do, we should be doing it, knowing full well the family history that we share.
Absolutely.
Right?
That, kind of that preventative, you're
Mom,
spot
if
on.
you're listening, you're definitely going to have to go see Dr. Delp. Right?
It's never, that's one other thing, that it's never too late to go on them.
Okay, that's basically what I was
there's
thinking.
even if it's a vaginal ring, estrogen ring for someone that has never been on, it's never too late for certain hormone therapies to help your long-term
Certain
care,
things.
to help certain things.
Yeah.
Well, probably
Okay, that's
everyone
good to know.
listening, and you and I both will be scheduling. So I hope you
Get
put
ready.
it on your calendar.
The men from
Convinced
Mydixadril.
us.
Yeah.
I'm so excited that
No
we
men too.
got.
I
So
don't
we
know.
really got to announce that on your show today,
That's
and I'm
pretty
super
awesome.
excited.
I know,
Yeah.
I'm really excited.
That's why I want
Women's
to message.
Ladies,
Yeah,
This
you're
is
gonna have
coming.
to use this on your socials so you can be like, you heard it first.
That is fantastic.
so genius. You're a marketing genius, Kat.
Oh,
And
thanks.
I didn't realize that you really had not been an entrepreneur for that long. Like
No.
that I would have thought, knowing and watching your business growth, your business, like your marketing, I mean, observing it, I would have thought this was something you've been doing for a very long time. Like you are a natural.
Oh, thanks.
And that is it's just so fun to see how you approach with like humor and authenticity. And we know that that's what sells, right? Authenticity is what
Yes.
people want.
Yes.
And you are so authentically you. And that is just the best. I love it. You can feel the energy. Like I'm sure you can even hear it if you're just listening. But your willingness to talk about these
Things that some people
subjects.
don't want to talk about.
Right.
Yeah. And
Just put it out there.
it's so refreshing. And I love that. If you don't follow her socials, Duluth Med Spa, you have to, because it's so interesting, entertaining, thought-provoking. Like it's all of that.
Thank
so,
you. Thanks so
yeah,
much.
seriously. It's really fun. And now I'm going to have to spend more time there.
It's a great vibe to be there too.
It's beautiful.
That it's all very pro female, pro women.
And we like putting you in the reels too.
Yeah.
It's so fun.
I'm mostly doing janitorial work.
You've created a beautiful space.
Thank
really
you.
like welcoming and just like you want to go there. You know, that's amazing
thank you.
too.
But you guys do you do online stuff as well.
Yeah, we do a ton of
So you don't have to be-
GLP-1. You
yeah,
don't have to be
from our
physically there. We do a ton of GLP-1 weight loss. And that's another thing, speaking of Alzheimer's. Studies show that GLP-1 treatment helps prevent Alzheimer's. In fact, I
Wow.
believe they're in phase 3 trials. Don't quote me, but I believe they're in phase 3 trials for another FDA approval for GLP-1 to help prevent Alzheimer's. It is huge.
Wow.
It is so big. There's so many uses and needs for people to either microdose or, keep that in your body, because it does go away, or, it starts slowing down, and
Yes.
especially in menopause, and we get that gut. But for Alzheimer's, it does help prevent Alzheimer's. Dementia is what they're finding.
Yeah.
That's
significant
incredible.
reduction.
Significant reduction in that.
They just came out with that journal that showed that as well. So we're all about, to your point, extending the quality of life instead of the quantity. Just,
yeah.
Yeah.
They go hand in hand.
Yep.
You know, the better quality you're living in your life, you're probably making better choices. You're mentally in a better place. Like that's like, I've been thinking a lot about that. Like the investment in your quality of life is actually an investment in extending your life.
That's right. It's investment in you.
And so start thinking about that young, because you're going to have to figure out how to afford it. And hopefully along the way, we can all figure out something about how to take down these insurance companies.
Yeah.
Huh?
I actually do really appreciate too that you have Mydixadril as well, because I think, to your point, like extend our own quality, but it's actually like about our tribe's quality. When we all rise up and do better, like then we want to support men. We want to support, our younger women, everyone to do better as well. So I'm really glad that you're getting into that as well, because sometimes we don't want to just so hyper focus on women that we forget that men actually have these needs as well. And while there is resources for them, there's been plenty of resources. There could be better things too, right?
We've always said that here.
Yes.
We focus on women's issues primarily, but
because we're women,
we're pro men too,
right?
We just,
of course, more pro women.
Yeah, we just know where the information is needed and what we're experts in.
Yes,
being them ourselves. So.
And what we were talking about too, just communication.
Communication.
That's the essential component of all of this. Is it's not a men's problem or a woman's problem. It's our problem.
It's a people problem.
And a relationship
problem.
Yeah, that's a really good point.
It's a relationship problem. So,
how many marriages might have had a different outcome?
I say that all the time. I think there's so many people that go through that time. It's that time period. Kids get out of school. Blah blah blah. There's all these different changes. And I tell men, it's like, it's not that she doesn't want you.
Yeah.
She doesn't have the ability to turn it on.
Yeah, her brain is out to lunch.
Yeah.
And they need to understand, that's a relationship
We've all been
issue.
there
It's
if
a
we're at that
relationship
age.
issue.
Yeah.
There's a divorce attorney that says that our business is the worst thing for his business.
Wow.
That's funny. Oh my goodness.
I could see that.
Well, so many reasons to get to know you too, via if you're local here in the Duluth area or through online ways of contacting you.
Yeah.
There's many reasons. Plus, they're super fun and obviously easy to talk to. So,
you can meet them at a bar wearing a really fancy suit coat.
Oh my God, great Halloween party guests. Which we need to talk about Halloween parties because we need to plan one. But,
yes, we do.
Well, we are coming up on time with these two. We are so grateful that they've given us their time and spent time here with us in the studio today. This is huge to have you two as guests. And just a little that we've had time to share about women's health, hormone replacement, menopause, sexual health. We've talked about a lot of things quickly. We've only scratched the surface, but I hope we can have you back to talk more in the future. And like I said, I'm volunteering as tribute, and I think Monique would too. If you need any case studies. So stay tuned for updates on the pod.
Thank you so much for having us. I really appreciate it.
Great.
Awesome. Well, until next time, we hope if you've been listening to the Heart and Soul podcast that you've learned a little bit today about advocating for yourself as a woman, or if you're listening to this and your wife is acting crazy, maybe you should ask her how her hormones are doing. So thank you for listening to another episode, and we can't wait to see you back here next time.
Cheers, friends. You've just finished another episode of the Heart and Soul podcast. We hope that you've enjoyed the show, and if you loved it, we would love if you'd leave us a 5-star review on whatever platform you're listening. You can find links to leave that review in the show notes, where you'll also find other resources that we reference on our show. And if you think a friend could find value in today's episode or any future episodes, please share this episode with them on social media. This is one of the only ways the podcast can organically grow, and we just can't wait to connect with you and all of your besties. You can also find Monique and I on our many social media platforms or our websites, and we're going to leave links to those in the show notes as well. Thank you for listening. We look forward to sharing our hearts and souls with you again next time. With Heart, I'm Mariah.
And with Soul, I'm Monique.